Ultrasound-guided peripheral IV insertion training for nurses in the emergency room. Melissa Allison Crosby. Peripheral IV access is often an important component to emergency department patient care. Failure to obtain peripheral IV access can cause a drain on the nursing staff, the emergency department physician, delay diagnosis and treatment, and expose the patient to pain of multiple IV attempts and the need for central venous access. Ultrasound has been shown to facilitate peripheral IV placement in emergency department patients with difficult IV access. This project is aimed at the importance of developing a training program for emergency room nurses to learn ultrasound-guided peripheral IV insertions. In the emergency room, time is of the essence, and when a patient comes in who needs an IV, the nurse can't spend 30 to 45 minutes looking for an IV access because this leads to emergency room stagnation and a decrease in patient flow. Common reasons patients are considered hard sticks are diabetes, cancer with a history of chemotherapy, cardiovascular disease, end-stage renal disease, contractures, dehydration, morbid obesity, history of IV drug use, and the inability of the nurse to visualize or palpate a vein. Ah et al. Reports that 23% of patients have veins that are difficult to cannulate by traditional IV techniques. So the question becomes, in the emergency department, does training nurses to use ultrasound for peripheral IV insertion on hard stick patients versus traditional peripheral IV insertion techniques decrease the amount of pain the patient experiences, decrease the number of IV attempts, and decrease the need to place central venous access? What is ultrasound-guided peripheral IV insertion, and why do nurses need it? Ultrasound-guided peripheral IV insertion is used when traditional methods of IV insertion have failed or when the patient is known to be a hard stick. When you have an IV catheter and an ultrasound, you can put them together and you come up with an ultrasound-guided peripheral IV insertion. Patients do not like to get stuck once with a needle, much less 3 or 4 times. A nurse can use the training he or she receives on ultrasound-guided peripheral IV insertion to relieve the patient of multiple IV attempts. Why do patients need IVs? Many tests require a large bore IV to be placed in the antecubital area of the arm or higher up. Patients who experience traumatic or emergent situations may require multiple large bore IVs for blood products, fluids, and/or medications. The advantages and benefits of training nurses to place ultrasound-guided peripheral IVs are: they reduce unnecessary pain inflicted from multiple failed attempts, it reduces delays in medical care, it reduces supply costs, it improves patient health care outcomes and satisfaction. Ultrasound-guided peripheral IV insertion also prevents the requirement of more expensive and higher risk IV procedures to include CVC placement like triple lumen catheters, PICC lines, implanted ports, and even intraosseous access. In a study by Stein et al., it is reported that once nurses are unable to place an intravenous catheter, the responsibility to obtain intravenous access typically is the emergency physician's, which can be a time-consuming process and can slow efficiency. In another study, this one by Dargan et al., they report, the operator in the study report that in 63% of patients in the study, a CVC would have been required had the ultrasound-guided attempt at peripheral access had failed. Training emergency room nurses to place ultrasound-guided peripheral IVs is safe, easy, ethical, and Watson's theory of nursing model can be applied to this training. Gene Watson's theory of nursing model has 4 major concepts: human being, health, environment, and nursing. Patients are human beings. They feel pain, sorrow, madness, happiness, anxiety. The emotional connection a patient experiences with IV insertion is real. IV insertion can cause anxiety, stress, and exhaustion in the patient. Ultrasound-guided peripheral IV insertion can alleviate a lot of emotion from an IV experience. Health and environment can go hand in hand. Watson considers health the absence of illness and that caring and nursing has existed in every environment. Patients come to the ER because they have an illness. The ER can be a scary and stressful place for the patient. The patient may receive a life-changing diagnosis like cancer while in the ER, or they could be told that their abdominal pain is no more than gas. The emergency room nurse's role is to care for the patient and provide a nurturing environment. A patient who experiences the pain of multiple IV attempts may not consider this pain a part of a caring and nurturing environment. His or her emergency room experience may lead to the belief that the ER is a stress or anxiety-inducing and torturous environment. Watson defines nursing as a science of persons and human health illness experiences that are mediated by professional, personal, scientific, aesthetic, and ethical human transactions. The number of IV cannulation attempts that a patient experiences can question ethical human transactions. The nurse's order is to place an IV, which is a professional and scientific skill that all nurses possess and a personal experience for both the nurse and the patient. However, multiple cannulation attempts violates the very basis of ethics. How ethical is it to continuously stick a patient multiple times before the nursing staff makes the moral decision to stop and try alternate methods for IV insertion? Ethics should govern after the first failed attempt, and the decision for alternate methods, to include ultrasound-guided peripheral IV insertion, should be carried out. This decision and the ability of the RN to place an ultrasound-guided peripheral IV coincides with three of Watson's definitions of the characteristics of a theory. It's logical in nature, relatively simple, and can be used to guide and improve practice. In nursing, ethics plays an important part in the delivery of care. Special consideration needs to be exercised when evaluating patients for IV access, not to stereotype based on history. The nurse should fairly judge patients on their actual vasculature status and not their history before labeling the patient as a hard stick. The literature of ultrasound-guided peripheral IV insertion is brimming with studies that support the training of nurses on this advanced skill. Decreases the need for central venous catheter placement in 85% of difficult IV access patients. Awe et al. Ultrasonographically guided peripheral intravenous cannulation of children significantly decreases attempts and procedure times in both the ED and operating room settings. Heinrichs et al. There is a growing body of evidence that demonstrates the clinical and economic value of ultrasound-assisted vascular access. In general, an overall improvement in success rates, reduction in the time taken for procedures, and a reduction in complications suggests better outcomes and lower costs. Lamperti et al. Use of ultrasound guidance is now widely recommended because it improves success and reduces complications. Even peripheral IV placement by the physician is time-consuming and may take the physician away from other activities in the emergency department. However, if an emergency nurse who routinely places IVs can utilize the ultrasound when faced with difficult cannulation, it could save the physician from having to intervene. Weiner et al. How does multiple failed IV attempts affect patients? The literature reports it causes physical and emotional stress on the patient, increases anxiety experienced by a patient, increases pain experienced by the patient. It increases costs, it may lengthen a patient's emergency department stay, and it wastes medical supplies. How does ultrasound-guided peripheral IV insertion training affect the nurse? The literature states ultrasound-guided peripheral IVs had a higher patient satisfaction compared to the traditional technique. It was twice as fast as the traditional technique, and it significantly decreased the number of skin punctures. Ultrasound-guided peripheral IV insertion also improves patient health care outcomes, improves patient satisfaction, and it improves nursing practice. In conclusion, in the emergency room where patients can face life or death situations, there is no time to waste. Patients who have difficult peripheral IV access can pose a challenge to emergency room nurses and staff, which leads to delayed treatment and diagnosis and emergency room lag times. Training nurses to place peripheral IVs using ultrasound can decrease these challenges and improve patient outcomes. Providing a training program for emergency nurses in ultrasound-guided peripheral IV insertion is easy, safe, and ethical. Ultrasound-guided peripheral IVs can be successfully placed by emergency department nurses.